Good afternoon, everyone. I am Dr. Riba Shakil. The topic of my presentation is a prospective study of prevalence and severity of primary open-angle glaucoma in type 2 diabetics. The aim of the study is prevalence and severity of POAG in type 2 diabetics. Other than this, the objectives are relation between duration of diabetes and glaucoma severity to study the variation of intraocular pressure in diabetics. It is a cross-sectional observational study done in 2 years and in a tertiary eye care hospital in North India. The sample size was calculated by this formula, and we got an approximate sample size of around 200. We included patients above 40 years of age. 200 patients we included, type 2 diabetics, both genders, willing to participate in the study. We excluded patients who are not giving consent, who have any other surface disorders, dense cataract, patient with secondary glaucoma or any other type of glaucoma or family history, patients with diabetic retinopathy, all patients with systemic illness other than diabetes or diabetes involving other systemic systems. Now, what has already been done in this topic, they have studied the glaucoma prevalence with duration of diabetes with various glycemic control index and with males gender with increasing age, but they have also included other types of glaucoma, other types of systemic illnesses, and also the cases of diabetic retinopathy. What has not been done is the determinants of diabetics only in relation to primary open-angle glaucoma. There's still a divided opinion between patients whether there is association with diabetes or POG or not, and there are very limited studies focusing only on POAG prevalence. So the need for present study is because there is increasing prevalence of diabetes around 455 million in today's scenario, and glaucoma worldwide. A less awareness of glaucoma in general population, and mainly the lifestyle and environmental risk factors, they affect diabetes and may also influence POAG. So demographic details, medical surgical history, duration of diabetes, treatment status, glycemic index, random blood sugar level, ophthalmic evaluation including intraocular pressure, gonioscopy, grading of severity based on perimetry severity criteria was done. The results showed that mean age of the population was 54. The male gender constituted 56%, female 44%. When we study the duration of diabetes and glycemic status, we see that mostly the people fall between 2 to 10 years, and the random blood sugar of more than 200 milligram per DL was seen in majority of the patients. Then HbA1c, higher HbA1c was seen in majority of the population, and most of the patients were using oral hypoglycemic agents. And most of the patients were falling between 12 to 20 mm of mercury intraocular pressure, and obviously we are taking open angles, but the severity of primary open angle mostly were falling in grade 2 and grade 4. So with glaucoma and demographics, we see with the increasing age, the red indicates glaucoma. With increasing age, the glaucoma risk is increasing. With male gender, the glaucoma risk increased with the higher IOP and higher cup disc ratio. Then again, the red bar is glaucoma. So with increasing age, with increasing duration of diabetes, the risk is increased. With increasing RBS level, more than 200 increased risk. With the increase in HbA1c, there is increased risk. And with the binary logistic regression shows only HbA1c is a significant, HbA1c level shows a significant association between glaucoma and diabetes. Glaucoma and severity, the red bar shows the higher severity of glaucoma, and it is seen in more duration of diabetes. The severity is seen with higher RBS levels, higher HbA1c levels. And these are the IOP variability what we studied in our study. And IOP variation is seen with the higher RBS levels and higher HbA1c level. So we conclude that among patients with relatively very short duration of diabetes, like in our study, the mean duration was only 5 years, the prevalence came out to be 10.5%. And the total of 19 patients had bilateral glaucoma, 2 had unilateral glaucoma. There's a significant association between higher IOP with the longer duration, higher RBS and higher HbA1c. On univariate analysis, glaucoma occurrence and its higher grade of severity is associated with these glycemic indices. On multivariate analysis, only HbA1c level were found to be significantly associated with glaucoma prevalence. These are my references. Thank you.
You said that stage 3 and stage 4 gonioscopy was there. What gonioscopy did you use, and what in gonioscopy you have given? Go to the in patients.
Grading of gonioscopy.
Yeah.
Schaffer's grading we use. Schaffer's grading system.
And what gonioscopy did you use?
We use 3 mirror. Goldman 3.
Thank you.
Thank you.
You have shown me one chart, so
Yes, sir.
what is the name of the chart?
Slides.
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 Last, I think second. Yeah, no, more. Yeah, so yeah. So what is the name of this chart?
Sir, this is box plot.